Has the daily routine of caring for your teeth and gums become difficult? Are there problems with dentures? Is dry mouth a frequent occurrence? Did you know that dry mouth is often a side effect of many prescription and over-the-counter medications? Do you use tobacco products? Are you a caregiver for an older adult and suspect that he or she is not brushing or flossing? These are common oral health issues of older adults, especially those who may have a cognitive impairment such as Alzheimer's or physical limitations from illness, perhaps a stroke or arthritis. Older adults may no longer have the strength to squeeze a tube of toothpaste or the dexterity to hold a toothbrush. Some may forget to brush or brush the same tooth over and over. Over the next several minutes, we will explore and explain these issues. We will show how to use everyday items to create adaptive products and help make the daily oral health care routine easier for the individual or the caregiver. When we are young, we preserve our oral health through daily care, teeth cleaning, or visits to the dentist. As we age, our bodies change. Older adults can become frail, and what were once simple tasks can become challenges. This includes taking care of the teeth, gums, and mouth. Unfortunately, many older adults also may not visit the dentist regularly. Neglecting oral health can lead to an epidemic of dental disease in our older population. Semi-dependent older adults may be especially at risk for oral health problems, which in turn can compromise overall health. Don't forget oral cancer. Tobacco use and excessive alcohol consumption are major risk factors for oral cancer.
Hi, I'm Dr. Marcia Pyle, Associate Dean for Education at Case School of Dental Medicine. We're going to talk about dental disease. We will also demonstrate for the older adult or the caregiver ways to help preserve oral health through daily oral hygiene.
You don't have to be a dentist to suspect there are problems with the teeth or the gums of an older adult. Some of the common signs that oral health has been neglected include complaints of pain, visible tooth decay, persistent bad breath, stained teeth, filmy or dull-looking teeth, bleeding gums, difficulty chewing, loose teeth, dentures not in the mouth, dentures that don't fit. Left untreated, dental disease will continue to worsen. It can cause or contribute to root cavities. This type of cavity progresses more quickly than a cavity on a crown of a tooth and may require more extensive repair. Gum disease, also known as periodontal disease. Let's explore some of the reasons for this dental disease.
There are over 400 medications that cause dry mouth. Other causes may also contribute to a dry mouth. Medical treatment for oral cancer is one, and also other systemic diseases such as Sjogren's syndromes can contribute to a dry mouth. Sjogren's syndrome is an autoimmune disease that has as a component of the disease dry mouth and dry eyes. If not appropriately dealt with, dry mouth can cause gum disease and cavities and quickly contribute to loss of oral health. There are a variety of products that patients can use and caregivers can use to help patients to help alleviate the symptoms of dry mouth. These include mouthwashes, which are alcohol-free, which is very important as alcohol can contribute to drying in tissues that are already very dry and irritated, to saliva substitutes, which are also available over the counter and help in wetting the tissues, and also chewing gum. These chewing gums that are available are sugar-free and do not promote tooth decay and can stimulate the production of saliva. Consultation with the patient's physician may be required in order to discuss changes to the dosing schedule of certain medications to ease the time of day when the patient might experience the most drying effect of those medications. Another reason for gum disease and tooth decay is lack of daily oral hygiene. Earlier we talked about the difficulties that frail older adults might have in holding a toothbrush. Here's a product where a toothbrush can be inserted into a manufactured plastic ball and the screw tightened. The patient can then, if they have arthritis or difficulty holding a short and small toothbrush handle, can easily grab onto this ball and continue with their brushing. Another product that's easy to find at the hardware store might be a rubber bicycle handle that a toothbrush can easily be slid into, and again, increase the size of the handle of the toothbrush so the patient may maintain their independence in daily oral hygiene. Taking a simple tennis ball, a slit can be cut in the top of the ball, and then a toothbrush easily inserted into that slit, making the bottom of the toothbrush handle a lot easier for a patient who is arthritic to grab onto, and again to maintain their oral health and independence in toothbrushing. Take a simple piece of tin foil and scrunch it up around a brush handle, and that allows the patient a bigger space to grip onto. Additionally, there are other products that can make dental flossing easier for a caregiver or a patient. Wishbone type holders for floss can make flossing a little bit easier. Also gets the caregiver's hands a little bit removed from the patient's mouth. This how-to information is available within the fact sheets that go along with the Smiles for Seniors program. Mrs. Kathy Nee, a registered nurse who is active in the Ohio dental community, will demonstrate with individual patients how to preserve and take care of oral hygiene. She will also work with caregivers to help them understand how to assist the individual senior in maintaining their oral health through daily oral hygiene.
Caregivers should always remember to preserve the dignity and self-esteem of the older adult. Allowing the individual, and in fact encouraging them to do as much of their oral hygiene as possible, will help to minimize or even prevent feelings of helplessness and depression. Here are some other points that I think are important to remember as well. Minimize distractions. Have good lighting in the room. Make sure that the individual has an opportunity to use the bathroom before you begin to do oral hygiene. Ensure the comfort and privacy of the individual while oral hygiene is being done. Close the doors, pull the curtain, or use a privacy screen if you have one available. Some individuals need to have directions given to them one step at a time in order to minimize confusion and frustration. Finally, don't forget to protect yourself from exposure to saliva or blood. Always wear gloves when giving oral hygiene, and if you're going to be positioned close to the individual's mouth, be sure to wear a face mask and goggles to protect your eyes from spray. I'm going to be showing Rosemary about how she can help you to take better care of your mouth and keep your mouth healthy. I have all the supplies we need over here. I've got a soft toothbrush, and I've got some fluoride toothpaste. You still need fluoride to keep your teeth strong, okay? So we're going to be using that. I also have a couple little cups. One has water in it to rinse your mouth. Another has some non-alcohol mouthwash. First of all, you want to make sure you have good lighting, and it's a real good idea to do it in front of a mirror as well so that she can watch what you're doing. Because I am a caregiver and I'm not a family member, I have my protective equipment. I'm going to put the mask on and I put goggles on because I'm going to be getting right in there close by you. I'm going to pour just a little bit of water over the toothbrush just to moisten it a little bit. And we don't need much toothpaste, just a little dab like the size of a pea. So we've got a moist, soft toothbrush. We got our fluoride toothpaste on it, just a dab. And we place the toothbrush at an angle so that it's at a 45-degree angle to the gums. And half of the brush should be on the teeth and half of the brush on the gums. And we do the outside of the teeth. And then we move inside, do the inside of the teeth, small back and forth or little circles. We want to do this for sure twice a day at least, in the morning and then at night before you go to bed. Now, as far as floss is concerned, we want a piece that's about 2 feet long. We're going to go down in between each tooth, and we're going to curve it in a C shape around the base of the tooth, back and forth a little bit, up and down. Then we're going to pick it up a little bit, go on the next tooth, the tooth next to it, and do the same thing. And we're going to put the floss down through and see how it slides. Now see that C shape? And then we're going to put it on the next tooth, up and down, and pick it up.
If you are not a member of the family and are having difficulty with the patient's daily oral hygiene regimen, it is important that you let the family know of the problems. Resistance to the routine could occur with a more physically or mentally challenged individual. Following are some thoughts for caregivers to keep in mind. Encourage the patient to help with his or her own oral hygiene routine. You may need to guide the hands. You may need to help with some or all of the oral hygiene care, or just supervise. Brush at least twice a day. Use a soft nylon toothbrush, water and fluoridated toothpaste. Avoid the use of swabs. These generally cannot do a complete job of removing plaque. Wear gloves, and when necessary, a mask and protective eyewear. Replace toothbrushes when old or frayed, at least every 6 months. Be careful that the person doesn't bite down on an object. Don't use toothpaste if a person is comatose. Sit comfortably with good visibility. To help maintain proper nutrition and keep teeth and gums healthy, older adults should continue to eat enough foods each day that contain calcium, protein, and other essential nutrients. A healthy diet will help keep the mouth healthy. Older adults, however, may not get a balanced diet, or in fact, they may not eat regular meals. And this too can hurt their oral and overall health. The U.S. Department of Agriculture recommends choosing from the 5 major food groups to help ensure a healthy diet every day. These food groups are meats and beans, grains, milk, fruit, and vegetable. Specific USDA nutritional guidelines are included in the fact sheets that accompany the Smiles for Seniors program. To keep the diet healthy, avoid or limit foods and beverages high in sugar and starch and low in nutritional value. Diet soft drinks should also be limited. The acid in these drinks can possibly contribute to tooth decay and gum disease. Drink alcohol in moderation. Check with the family physician to see if a daily multivitamin or mineral supplement is recommended.
As you know, tobacco use in any form contributes to the risk of oral cancer. Therefore, it would be important to urge smokers or tobacco product users to stop using. There are a variety of products available, including patches or gum, so your health professional can help you decide which one might be most appropriate. Oral cancer is also a concern for aging patients. The risk of oral cancer continues even though a patient may not have teeth. One of the important things about oral cancer is that it is not painful in its early stages. Therefore, patients may not be aware that something is not quite right, and unless oral health care workers are very diligent about examining patients who are at risk and as routine screening practices, oral cancer can be missed. All patients should undergo an oral soft tissue exam to inspect the tissues to assure that they are healthy, at least on an annual basis. There are a couple of areas that are in particular good places to examine because they have a higher risk for the development of oral cancer, and that is on the side of the tongue, or what we call the lateral border of the tongue, and in the floor of the mouth underneath the tongue.
Even with full or partial dentures, daily care of the mouth and gums and any remaining teeth will help keep the mouth healthy. If you wear dentures and experience pain, looseness, or any other difficulty, let the dentist know.
I understand that you have dentures, so you know, of course, that even with dentures, you don't just brush the teeth, but you have to remove them from your mouth and brush the insides of the dentures and clean off your gums and your oral tissues as well, and rinse your mouth, okay? When you brush your dentures, when they're out of your mouth, you want to make sure that you pad the bottom of the sink and fill it partway with water so that if by chance you should possibly drop them, you know, then at least the dentures won't break. Now, Rita, what we have here is we have a special denture brush to use for your dentures. We also have a regular soft toothbrush because once you take your dentures out and clean them, you don't want to put them back in until you've cleaned away the bits of food particles that might be left on your gums and in the little hidden areas of your mouth along your cheeks and that kind of thing. Let's go ahead and start. I'm going to have you remove your denture, take the upper out, and go ahead and put it in the cup. Okay, very good. I'm going to have you take the denture toothbrush and put a little bit of denture toothpaste on it. You're going to clean, you can do that there, right, and inside, that's it. That's it, great. And do the part that goes against your palate, that part there, that. And we can rinse them off. Okay, very good. And so now it's time to take care of the rest of your mouth. You have some teeth remaining in your mouth. You need to take care of those. Do the outside of your teeth, your bottom teeth first. Okay, all the way back to your last tooth. Now do the inside of your teeth, the bottom teeth. Good. And then the chewing surface of your teeth. Okay, now your dentures fit pretty well. You don't hear any, feel any clicking of your dentures when you're speaking?
No, only when they go in and out.
Okay, okay, good. Because if they clicked a little bit when you spoke, or they keep falling a little bit, slipping, you need to see the dentist. You don't feel any sore spots in your mouth at all?
None.
Okay, and you always take your dentures out at night, right?
Right.
You soak them in just plain water?
Right.
Okay, that's fine. So we do want to keep them moist at night, and that time without your dentures gives your tissues a chance to recover a little bit from the pressure that the dentures put on them. And before I forget too, another reason, of course, to go to the dentist is also they do oral cancer checks. So not only would they take care of your dentures and your remaining teeth, but they're also going to look at your tissues to determine that they're healthy and there's no signs of beginning oral cancer.
Preventive care is the best protection of your oral health and can help preserve a healthy smile for the rest of your life. There are several simple steps to follow. Brushing and flossing daily. Preventive therapeutics as prescribed by the dentist. For example, a fluoride toothpaste or fluoride treatment or dental sealants. Visiting a dentist twice a year. Oral cancer screening. The best way to maintain good oral health and treat dental disease is to visit the dentist twice a year. The dentist can tell you about the best type of fillings or other treatment options that exist and would be best for you.
In the first segment of this program, we talked about tips to help maintain the oral health of older individuals. Much of what we discussed is applicable for nursing home patients as well. There can be many issues to consider regarding oral hygiene of patients in a long-term care environment.
These include staff may need to encourage patients to do his or her own oral hygiene. Staff may need to assist patient. If assisting, be sure to sit comfortably and have good visibility. Use a soft bristle toothbrush. Use fluoridated toothpaste. If needed, use a sensitive toothpaste. Practice accepted infection control procedures. This includes wearing gloves, mask, and protective eyewear. Do not use toothpaste on a comatose patient. Check for red or swollen areas of the gums. There could be food stuck. Brush and floss these areas. If possible, brush the tongue to help keep breath fresh. Always rinse the brush after and let air dry. Keep brushes labeled for each patient. Make notes of daily oral care in the patient's record. If a patient is resistant, try and determine why. Is there tooth or gum pain? Attention to causes of patients' resistance to care can be important in developing strategies to complete oral care.
In conclusion, the oral health status of dependent and medically frail patients is an important general health consideration. We encourage the staff of long-term care facilities to incorporate a specific daily oral hygiene regimen for patients into their daily routine. This should help achieve the best possible health outcome for those residents of the facilities. We hope the information in the Smiles for Seniors program is useful in helping to maintain and preserve oral health for older individuals. For more information about oral health and oral health issues, please consult your dental health professional.